Welcome to the Pulsenmore Clinician Onboarding Training Series. This is a 4-part training tutorial. In this second training session, we will focus on the patient side setup of the Pulsenmore ES system. In this tutorial, we will cover the essential basic requirements, Cradle setup and performing a compatibility check, and we will end the session by explaining the scanning procedure. Before scanning, let's make sure everything is properly prepared from the patient's perspective. We recommend removing the smartphone case to ensure a secure and seamless fit with the Pulsenmore Cradle. The patient should ensure their phone is fully charged. For iOS users, the Pulsenmore device itself must also be fully charged. Please note that a charger is not included in the kit. Both you and the patient should have a strong and stable internet connection throughout the session. The patient should also have ultrasound gel available, as well as wet wipes for cleanup after the scan. Pulsenmore offers 2 device versions, depending on the patient's smartphone operating system. To identify the version, turn the Cradle over and check the label. iPhone-compatible devices have serial numbers beginning with PAA. Android-compatible devices have serial numbers beginning with DAA. Smartphone compatibility. The patient must confirm that their smartphone is compatible with the Pulsenmore system. The 2 most recent iPhone versions are always compatible. For iPhones older than version 15, please contact your sales representative. Many Android devices are also compatible. To verify compatibility, the patient can perform a check directly within the Pulsenmore app. To begin, the patient should download the Pulsenmore app to their smartphone. Once installed, they should open the menu in the top left corner and select Compatibility Check. The app will guide them through a quick process to confirm that their device meets the minimum system requirements for high-quality imaging. Once the check is complete, the verification screen will appear. If the device is not compatible, you may recommend that the patient use an alternative smartphone available to them during the pregnancy. Scanning procedure. The Pulsenmore app provides guided training before the patient's first scan. Pulsenmore supports 2 scanning modes, app-guided and clinician-guided. Let's begin with the app-guided mode. During an app-guided scan, the screen is displayed in split view. The top section shows a visual guide demonstrating the required cradle movements. The bottom section displays the live ultrasound image. Patients can perform the scan independently without clinician assistance. The process typically takes about 3 minutes. Once completed, the scans are automatically sent to the clinician dashboard for review and diagnosis. Now let's review the clinician-guided mode. In this mode, the patient selects Start and is directed to a virtual waiting room. They will remain there until you begin the Pulsenmore video consultation. After the session, the recorded scans are automatically uploaded to the clinician dashboard for your review. This concludes Part 2 of the Pulsenmore training on patient side setup. In Part 3, we will cover the clinical setup and features of the Pulsenmore dashboard.